2018 was definitely a rough year for me. For the first time in my life, I lost someone whom I dearly loved, my grandmother. She suffered a massive heart failure for 3 years. Due to the shocking death, my life is totally different. My name is Siti Maisarah Binti Sazali and I'm from T04. Topic of my informative speech is regarding heart attacks. For your information, heart attack is one of leading causes of death globally. The World Health Organization estimates that 7.3 million deaths globally were due to coronary heart disease. Over 18,000 people in Malaysia died for the same reason. Whether you have had a heart attack or if you are close to someone with a heart attack, you must remember this. You are not alone. Tens of thousands of people in reality survive heart attacks and continue to lead enjoyable lives. Awareness is power. Arming yourself with this information can help you live a healthier and longer life. I genuinely trust that information about heart attacks is crucial for us to know and take precautions in our life. Besides, I also did my research regarding this congenital heart disease from various resources. Therefore, now I'm going to enlighten you about this crucial topic with factual and valuable information. Without further ado, let's explore the specificity of this disease. What causes heart attacks? Fatty deposits or plaques develop on the walls of our coronary arteries. Based upon my research on the website Mayo Clinic, vessels supply oxygenated blood to the heart. These plaques inside the vessels grow as we age, sometimes getting chunky, hardened, or inflamed. Eventually, the plaques can turn into blockages. If one of the plaques ruptures or cracks, a blood clot will form around it in minutes, and a partially clogged entire artery can become completely blocked. Blood flow is cut off to the cardiac muscle and the oxygen-starved cells start to die within several minutes. Moving on to another important piece of information. How do you know that someone is having a heart attack? Well, the most common symptom is chest pain caused by the oxygen-deprived heart muscle. Patients describe it as crushing. It can radiate to the left arm, jaw, back, or abdomen. From a website Centers for Disease Control and Prevention, reported in the website's January 11, 2021, mentioned some people experience nausea or shortness of breath. Symptoms may be less prominent in women and the elderly. For them, weakness and tiredness may be the main signal. Now that we have seen the problems causing heart attacks, let's examine how to cure the deficiency illness. According to American Heart Association, in the emergency room, doctors can diagnose a heart attack. They commonly use electrocardiogram to measure the heart's electrical activity and a blood test to assess heart muscle damage. The patient is then taken to a high-tech cardiac suite where tests are done to locate the blockages. Cardiologists can reopen the blocked artery by inflating it with a balloon in a procedure called an angioplasty. Frequently, they also insert a metal or polymer stent that will hold the artery opened. More extensive blockages might require coronary artery bypass surgery. Using a piece of vein or artery from another part of the body, heart surgeons can reroute blood flow around the blockage. These procedures re-establish circulation to the cardiac muscle, restoring heart function. Last but not least, it is never too late to take steps to prevent a heart attack, even if you have already had one. Firstly, doctors recommend exercising in a few times a week, doing both aerobic activity and strength training. For instance, cycling, swimming, and jumping rope. Hippocrates famously said, "Let food be thy medicine," and that applies to heart health. Lots of fiber from vegetables, chicken and fish instead of red meat, whole grains and nuts like walnuts and almonds all seem to be beneficial. Medications can also help prevent heart attacks. Doctors often prescribe low-dose aspirin, for example, particularly for patients who have already had a heart attack and for those who are known to be at high risk. And that is all. Heart attacks may be common, but they do not have to be inevitable. Let's recap on what we have learned in this video. In the first place, I mentioned about how heart attacks happened. Just in the same way, I exposed methods to know someone is having a heart attack. Finally, I suggested techniques on how to avoid probability on acquiring heart attacks. After this, you will realize how essential for you to practice a healthy diet, staying fit, as well as enjoying plenty of sleep to make sure your body's most important muscle keeps on beating. Hence, I think that it's all from me sharing about this serious yet interesting topic of heart attacks. My aim is to encourage you to develop a healthy lifestyle and see a doctor for regular checkups for your own health and your loved ones. Thank you.